Hey, so we're here with Christian, and it's a happy day. He's here for his 1 month post-op after LASEK non-cutting surgery. But the important thing is that he actually had two unusual conditions: lazy eye or amblyopia, and nystagmus, which is the eyes going back and forth. So we want people out there to understand we're the only center in the United States specializing on this. We did a Google search, and about 100,000 Americans have nystagmus. Most of them don't know about this, and I guess Christian did some heavy-duty Googling. So you want to tell the audience how you found out about uh, the, the procedure or the center?
Sure, I will. What I found out was this. I had just Googled laser eye surgery for nystagmus patients. About every 5 years, I try to check in on new technology and things of that nature. Uh, when I just Googled laser eye surgery for nystagmus patients, I only found a couple other places in other countries. And I come to the realization if one man can do something, somebody else possibly can too. And I refined my search and I looked up laser eye surgery for nystagmus patients in the United States, and it led directly to Park Avenue LASIK
And I'm
and
just
Dr.
curious,
Chynn.
like, what are the other two countries that you found?
I found a clinic in Georgia, not the state of Georgia, the country of Georgia. And then also I found an outfit in London, England that possibly could help me. I initially reached out to them. I didn't get a warm and fuzzy feeling about it. And then I just said, well, look, somebody in the States has to be doing this. And I reached out to Dr. Chynn when I found Park Avenue LASIK by Googling laser eye surgery for nystagmus patients in the United States. It was a little extensive search, but I'm one of those guys that doesn't quit.
Yeah, I guess you're a structural architect engineering guy, and then I guess you did some work at Johns Hopkins. So you must have had some experience in medically that way. And I think you said your ex-wife also is medical or something,
I mean,
right?
she was a shock trauma nurse at another hospital.
Yeah, so
Yeah.
more motivated and more knowledgeable than the average patient. But the reason we're doing this video is so that the average patient doesn't have to do that much work, and you can kind of help smooth the pathway. So you want to talk a little bit about, I guess, the pre-op experience and what your expectations or motivations were, Christian?
Well, I realized at this point, years ago, I had found a website back in '98 called the American Nystagmus Network. Check out nystagmus.org. Okay, the website. It's still around. It was very rudimentary back then. I found it on Netscape Navigator, which many of you all have never heard of if you were born after 2000. But I'd gone back to it a few times, and I read a lot of testimonials on that rudimentary website back in '98, and I could still remember it. And a lot of people stopped driving, stopped hunting, stopped playing sports when they were about 45 to 55. And, it concerned me. About 2 years ago, my local eye doctor noticed that I was starting to lose visual acuity in my left eye. I was really concerned about that. And it really kicked things into motion. I'm 50 years old. In 5 years, I have to renew my license. And if I can't drive, I lose my very successful career. And I was very concerned about that. So, here I am. I was fortunate enough to do the right Google search, and I found this place, and it's been wonderful ever since.
Hey, how do you think the procedure was? Like, was it painful? Was it harder or easier than you thought? Because a lot of people watching this video might say, I want to do it, but I'm afraid of the procedure itself.
Look, I'll tell you what, it wasn't painful at all. If you're worried about that, he offers Valium, ketamine, laughing gas, whatever your parlance is. I decided to do that. I wasn't necessarily nervous because I think, the last person that day you operated on. I got to watch a couple surgeries, and I'm like, wow, this isn't all that bad. It didn't hurt. He numbs your eye. I didn't smell anything weird or anything like that. That's a common complaint.
It smells like burning hair or something.
Yeah, and it didn't. And really, he puts some contact lenses on your eyes that you'll have for a week. And really, the only thing that hurt is when I put the steroid drops in, but it was less than getting lemon juice in your eye when you squeeze it into iced tea. So this doesn't hurt. It never really hurt. The drops hurt a little, it burn a little, but it's not that bad. If you've ever had lemon juice in your eye from squeezing it in your iced tea or another drink, that's about as bad as it gets, if not much less.
Yeah, I think one of the drops we have contains liquid Motrin to prevent pain, and it stings a tiny bit, but not a lot. So then, why did you decide to do this? Like, what was your primary motivation, Christian?
You know, I've lived this life for many years, and I've been told no by so many people. It's unreal. I've been told a lot of goofy things. Okay,
Like what?
okay, I'll tell. No, this is funny. You'll like this. Uh, I've been told when I was in my 20s, and it's tough. And nystagmus can be isolating. It's hard for people to understand. You just don't see it all that often. And I had an eye doctor say, "Well, there's nothing we could do for you. You're stuck. And why don't you print out a card that says I have congenital nystagmus and pass this out at bars?"
No, that's not cool.
No, no, not at all, not at all. And other things I was also told probably about 7 or 8 years ago was, hey, wait until you're 65 and have cataracts and we can replace your lenses. Then you'll be able to see. I mean, things like that. I've been told a lot of goofy things over the years. And once I reached out to Dr. Chynn and Park Avenue LASIK, we met over the app they
Yeah, we did
use.
like a
We did a FaceTime thing, yeah.
yeah.
And he looked at me, he said, put it up to your eye. And he says, oh, you got a mild case. That isn't too bad. I've done guys worse than you, way worse.
Way worse.
Yes.
Way worse.
So, here I am. I'm 1 month post-op. Things are going great. I'm seeing
much better, right?
Oh, totally, totally. I'm seeing so much better. It's unreal. Happy to be here.
Most of the nystagmus patients say their nystagmus got a little bit better.
Mine have dampened a little bit. I'd say 30% maybe, but it was still something. I can focus a little better. Things aren't moving around.
Yeah, we've done about 100 patients, and none of them has gotten worse. Most of them got better, some significantly, some a little bit, and some better enough that they said it helped them psychologically because at a bar, people kind of don't notice they have nystagmus. So better is better.
Yeah, I agree.
Dr. Chynn, can you spend a minute talking about how
the procedure
different the procedure is for nystagmus patients?
Yeah, so his right eye had a less nystagmus, so the laser was able to track. We have a really good tracker on the laser. I've gotten very good at this over the years. Been doing this about 10 years or more. So there's a little bit of lag when you're trying to make the laser lock onto the eye. So what you do is I have to push the pedal, and when the eye's here, then there's a lag, and then it locks in the center. That's just really experience. And then the left eye was moving too much, so we have a little fixation ring, and we used it on your left eye. It's just got a little nubs that keeps the eye from moving.
Mm-hmm. Didn't hurt. I felt a little pressure. It's not all that bad, and it worked.
Yeah, I think the ketamine, the Valium, the nitrous helps. We're the only center that really has laughing gas or FDA-approved ketamine. Everyone uses Valium, but sometimes I think on the more complicated patients, it's helpful. People with anxiety disorder. So I guess the main message out there is that anyone who is told that it can't be done is not actually true. We're doing this all the time. So anyone with a lazy eye or anyone with nystagmus should really come. Most people are flying in from other states, so we could do a remote consultation. And then after that, review records. Sometimes we talk to a local eye doctor, and you're actually seeing the local eye doctor for some of your post-ops to make it more convenient. So we're going to see him today just for the 1 month post-op, and everything else is going to be local. So you don't have to worry with people flying in from California, and sometimes with people flying in from other countries for this.
Yeah. So, yeah, and I came from below the Mason-Dixon line, came up here, Mid-Atlantic region, coming to New York to get this done, and it's been great ever since.
Yeah, it's not that bad. You only have to stay a few days for us to do post-op. You go back, and I think we had the doctor back home, Dr. Jane, remove your bandage contact lens. So we're trying to make it as quick, easy, and affordable for people as possible. And then I want to thank Christian for doing this public service announcement because I'm kind of getting ready to retire in the next year or so. So we just wanted to make sure that these 100,000 people out there know it could be done, and I guess they have to come in pretty quickly for me to do that.
Yeah, I agree. I found you at the right time, I think.
Thanks a lot. I really appreciate it.
I really appreciate it too. Okay. Thank you so much, Dr. Chynn.
You're welcome. Bye.
All right, see ya.
Just one more point.
Sure.
A lot of patients with nystagmus, a lot of people with nystagmus, they've heard of ASA helping. How ASA, advanced circumcision, being able to help with nystagmus.
You think people have heard that?
Let me just ask one question. However, they're worried about the alcohol aspect of ASA.
You've heard this?
Can you talk a little bit about
It's news to me.
No, look, I think it's a weird question. I think basically a lot of people are told they can't do anything because it's not safe to cut a flap when the eye's moving around. So the reason we can do this is we're not cutting a flap in the LASIK procedure, which is like an advanced PRK. So yeah, so a lot of times people say it can't be done because it's not really safe to cut a flap in a moving eye. But yeah, basically we're not cutting a flap. Is why we could do the procedure.
But what about pneumo?
Well, no one really knows about pneumo, so yeah, okay. So I invented a new procedure about 3 or 4 years ago where you use a little air device to suck the eye up into that, and then sometimes we could do that instead of the fixation ring. So basically, we can get the eye so it's not moving during the procedure.
Okay.
Those are good questions, Constantine.
Thank you.
Okay, thank you.